Hello dear students, welcome to the Quick Learning Bytes at Doctutorials, and today's Quick Learning Byte in Ophthalmology is on Toxic Optic Neuropathy. So friends, a patient presents with an acute bilateral severe loss of vision. This loss of vision may be bilateral, which is symmetrical or maybe asymmetrical. So friends, on perimetry, on visual fields, we may see a central scotoma or a centrocecal scotoma. But remember an important mnemonic which tells you about the causes of the toxic optic neuropathy. So the mnemonic is medicals. So M stands for methyl alcohol, E stands for ethambutol, D stands for digoxin, I stands for isonic acid, C stands for three things: cyanide, chloramphenicol and chloroquine. A stands for amiodarone, L stands for lead and linezolate, and N stands for sildenafil.